comes to vaccinations, we have 39.3% of Victorians aged 18 and over who have had their full 3 doses of vaccinations. There were 17,799 doses delivered at the state-run clinics yesterday, and a significant number more than that delivered through our primary care partners in GPs and pharmacies yesterday as well. When it comes to children aged between 5 to 11, we saw a further 1,645 kids vaccinated in our state-run clinics yesterday. That brings to a total of 258,407 children aged 5 to 11 who have received at least 1 dose, which is some 45% of that age group. Jerome will speak further to some of the logistics and the details behind both numbers in more detail shortly. In regards to COVID-19, we are seeing currently 851 people in Victorian hospitals with COVID-19. That is down from yesterday's figure of 873 and is also below the rolling 7-day average of 925. Yesterday we had 102 people in ICU, and today we have 106 people in intensive care as of 6 a.m. this morning. So an increase of 4, but in regards to people on ventilators, we have 30 people on a ventilator with COVID-19, down from 33 yesterday. Tragically, 34 Victorians are reported as having died over the last reporting period with COVID-19. That is 34 families, friends, communities grieving for the loss of a loved one, and we send our deepest condolences and best wishes to those families and communities in this time of grieving. 13 of those 34 were deaths within the last 2 days, with the remainder coming in previous to that and having been reported to us yesterday. In regards to testing, there were some 7,060 people reported via positive rapid antigen tests yesterday through the self-reporting mechanisms online, and some 4,251 people returned positive tests through the PCR testing system, which gives us a total of 11,311 people returning a positive test yesterday. That is up slightly on the day before, but down in regards to the rolling 7-day average of 11,921. Pardon me, the 7-day average is in fact 11,921, which is a significant reduction from the week prior, which was running at just over 16,000. All of which brings to a current number of active cases in Victoria of 72,710 cases of COVID-19, a significant number but substantially down on where we have been in recent weeks. In regards to why we're here today at ScienceWorks, it's because very much our focus is on vaccinations. Whether it be vaccinations in schools and the testing that's associated with that, our pop-up program, or whether it's in fact it's our vaccinations for 18-year-olds and above, or in fact, as we're here today, to make sure that we make it as easy as possible, particularly for kids in that 5 to 11 year age bracket, to get their vaccinations. Commencing on the 12th of February, we'll be launching our K-POPs program, which is a vaccination program for kids, but particularly vulnerable kids, their families and the communities that they're a part of. We know that we need to make it as easy as possible for kids in vulnerable groups to come forward and get their vaccination. We want to make it exciting as possible. So that's why it's a great initiative that our iconic venues such as Science Works, such as the Aquarium, the Zoo and a number of other facilities have joined up with the Department of Health to make this K-POP program an exciting addition to the measures where particularly vulnerable kids and their families can have an exciting day out and get their vaccination program. It's a fun and enjoyable way for those kids who we know find it hard given other measures of disadvantage and lack of access to services, to have support to get these important vaccinations. And to get them, particularly in these groups of kids, will allow our focus on schools being able to be returned safely and sustainably over term 1 and beyond is so important. We know that we don't want any members of our community left behind when it comes to the vaccination program. The K-POP program, targeting disadvantaged communities, kids with disabilities, kids in the out-of-home care program, kids in the youth justice program, and their families need the support to go that little step extra so as to make sure that we get the highest possible vaccination rates for the communities that find it the hardest to access services. So I want to thank Museums Victoria and Science Works for the great work that they have particularly done in making sure that this great facility here and all the other partners who have joined with the Department of Health to make sure that we get those kids, particularly vulnerable kids and their families, vaccinated. I look forward to this program starting on the 12th and continuing until mid-March so as to drive up those rates for our 5 to 11-year-olds and indeed their family members. This is in addition to the programs for the Enchanted Forest program of the more than 50 locations where state-run vaccination clinics are available, and indeed the many, many hundreds of the community pharmacies or general practitioners who continue to lead the vaccination rollout for not just 5 to 11-year-olds, but anyone who's now eligible for a vaccination. I might ask Jerome to fill in some of the further details of the program and other arrangements in place, and then I might get Lindley to also talk about how services such as facilities such as Science Works are a part of this important program. Thank you.
Thank you, Minister, and good morning, and great to be out here in the West. Over the last a year or so now, the state vaccination program has delivered over 5.6 million vaccinations through our high volume clinics, including places like the Royal Exhibition Building, the old Ford factory at Geelong, and many other places, over 50 locations where we focused on providing first doses, second doses, third doses and 5 to 11-year-old vaccinations to make sure that access is as easy as possible, to make sure people can get seen quickly. And even now today, if you need to get your third dose vaccine, or if you want your child to get a 5 to 11 vaccine, you can always come to any of our state clinics. Very short waiting times, quick turnaround times. You're in and out in under half an hour to get your vaccination done. That, of course, is in addition to the phenomenal work of over 1,238 GPs and pharmacies all across the state who are also an active, the leading front of vaccination into their communities. And can I thank everybody who's involved, the GPs, the pharmacists, their support staff, and of course our state clinics for the phenomenal work they've done in continuing to drive vaccination every single day, 7 days a week. But we've always recognised right from the middle of last year onwards that there was always a need to provide to address some of the barriers that some members of the community face in getting access to easy and effective vaccination. So we've run extensive pop-up programs in a whole range of scenarios, whether it's been our schools program last year, the churches, the mosques, the local community places, all across our state. And the focus for all those was to make vaccination easy, accessible, but also in a safe and comfortable environment, which allows everybody, all Victorians, to make the right decision for them, to make an informed decision, and to come forward and get vaccination in a place, in an environment where they're comfortable. And of course, we've continued now on with our school vaccination program with 5 to 11-year-olds, and great to see kids return to school yesterday. Over the last weekend, at 14 participating schools across Melbourne's particularly northern and western suburbs, we delivered over 6,000 vaccinations to kids and their families across 14 different school pop-ups. Again, choosing places where there is lower coverage of GPs and pharmacies and making it that bit easier for those 6,000 or so people to get their vaccination done over the weekend. And I'm excited again about another 15 schools that will be running in the coming weekend, again similarly bringing vaccination right into those communities. We've also recognised, of course, particularly with 5 to 11-year-olds, that we need to create a safe and comfortable environment for kids to get vaccinated. And I think the Enchanted Forest work that we've been doing over the last month has been really successful. Over 250,000 kids now vaccinated in that 5 to 11-year-old program in a really safe, engaging, comfortable and I think memorable space for those kids to get their vaccination journey underway. And the K-pop program that the Minister's just announced is really the next logical stage for us. We're working very closely with a number of our social care partners all across the state. We've identified a number of iconic locations, places where children want to go, where children want to explore and really get the best out of their childhood, to make also possible for them to get their vaccination done for them and their families at the very same time. So I stress this is hundreds of children who will be invited to take part in this program from February the 12th. They're already being worked over very closely with relevant social care agencies, and really it's about creating a memorable and important day for them and their families to make vaccination a part of what they're doing, not the only thing that they're doing. I'd like to thank in particular, of course, ScienceWorks, our launch partners here today, but we're also working at really I think for the iconic sites we've run for the whole vaccination program. These are really the children's iconic sites across all of Victoria and Melbourne, in particular Melbourne Museum, Melbourne Zoo, the Sea Life Aquarium, the Immigration Museum, Legoland, the State Library of Victoria, and into regional Victoria, Healesville Sanctuary, and of course Werribee Open Range Zoo. And can I thank those venues for their partnership and their creativity in trying to ensure that they reach out to their local communities. I think making those places another critical landmark really on the map of so many of our young people. Can I please highlight though, these are not going to be the high volume vaccination centres that we run at the Royal Exhibition Building or at the Ford factories. These are very bespoke. We'll be doing hundreds of people a day at these locations, not thousands. They are not walk up. Please do not go there today. Do not go there next week. You'll be invited to participate in that programme if you're part of that particular network. Of course, if this has prompted you to think about, actually I need to get my own child vaccinated or get myself my third dose, please go to our website. You can make a general booking. There are literally thousands of slots available. We have 82,000 appointments available for children aged 5 to 11 over the next 30 days. We have over 250,000 third dose bookings available over the next 30 days in our mainstream system. So plenty of opportunities to get your vaccination done, but great to see this K-pop program reaching another group of Victorians who will be so very keen to get vaccination journey underway. Finally, in terms of the overall numbers on vaccinations so far, so we've now seen almost 2.1 million Victorians get their third dose, and again those numbers continue to increase every single day. 64% of those Victorians aged over 70 have now had 3 doses, 55% of those over the age of 60 have had 3 doses, and 49% of people in their 50s have had their third doses. Vaccination continues to be the way that we avoid people getting into ICU and getting into hospitals. So please, I'd encourage everybody now, there are 2.3 million people today who are eligible to get their additional vaccination done. We'd really like you to make it a priority to get that done through your GP, through your pharmacy, or indeed any of our state clinics. With that, let me hand over to the CEO of Museums Victoria, Lindley Crosswell, and thank her for her partnership in working with us to make this happen. Lindley.
Good morning, welcome to ScienceWorks. Well, we know from science that vaccinations work, and that's why we're so proud to support this initiative to deliver vaccines to more children at our museums. And when they come to ScienceWorks, Melbourne Museum or Immigration Museum, once they've had that vax, we'll make sure that they and their families just have the best time possible, the best day out at the museums. We look forward to welcoming them. It's a safe, happy and fun environment, and they just get a vaccination along the way and a day of fun. Thank you.
Thanks, Lindley. Thanks, Jerome. Just one thing before I open up for questions. Today, Services Victoria have also upgraded the Vic app regards to logging on. You will see a prompt for the third dose, together with a whole range of other measures to encourage the Victorian community to both come forward and get their third dose, or indeed further information about rapid antigen tests and a whole range of other further information provision to help drive the Victorian vaccination rates, which continue to be our strong focus in this and coming weeks. So I want to thank Services Victoria for their continued effort in that regard, and encourage all Victorians when they log on to that app to go through that information if you're one of those many people who are now due for that third dose, to come forward and follow the prompts and get that booking in. Do your bit to protect yourself and of course to protect our healthcare system. Thanks. Any questions?
When will we find out which other sectors need to give what groups that have been mandated for?
When will I find out?
What other sectors will the booster need to be mandated for?
So mandates are one of the tools of driving up vaccination rates. They were a key feature right across the country in 2021 of making us one of the most vaccinated communities on the planet. And in that regard, the process, as we all know, is pretty straightforward. The Australian Technical Advisory Group on Immunisations consider what constitutes being fully vaccinated. They're going through that process. All the states and territories are contributing to that, and in the very near future, from my discussions with officials, we would expect the Australian Technical Advisory Group to advise the National Cabinet on that outcome, and once that advice is given, then the states and territories will go about the process of consultation as we have in previous times to drive those vaccination rates up to what means fully vaccinated. And in the context of 2022 and the Omicron variant, that will mean 3 doses.
The Chief Health Officer yesterday said he hadn't given any advice on a booster mandate, and I understand that the acting show has previously said it wasn't yet justified as well. So why is the government coming out so strong on this when those two experts haven't?
Well, for the very reasons, the process that I've set out. The first step of the process is the Australian Technical Advisory Group on Immunisations determine what constitutes being fully vaccinated. The states, or many of the premiers, all of the health ministers are strong advocates for ATAGI to carefully but speedily resolve that issue. It will be 3 doses for the general community. For people who are immunosuppressed and other at-risk groups, it will be 4 doses. And once the Australian Technical Advisory Group on Immunisation make that decision, then we go through the processes at a state level of seeking to drive up the vaccination rates in accordance with that decision. That's how the system works. Yes, every day, including today, we consult with both the private hospitals and the public hospital sector around just where the situation is when it comes to when will it be appropriate to turn back on elective surgery. We apologise for the disruptions and delays that this necessary measure has caused. It's not done out of any other reason than making sure that the people with the greatest health demands get the priority of service right across our system. And that means those many hundreds of people who need hospitalisation with COVID-19 get that support from both the public and the private systems. And I want to thank everyone in the hospitals who's been involved in that. In regards to where we are in that process, like many other jurisdictions, like in fact all other jurisdictions, measures of reductions and deferrals of elective surgery have been put in place. Our friends in New South Wales, whether it be the initial outbreak of Omicron, the peak and coming off the peak, have always been about 2 weeks or so ahead of ourselves and a little bit further ahead in Queensland. And as we work through those issues, I would expect that we will come to a landing on those issues. I do note that New South Wales, it's for private hospitals and some regional hospitals. It's not a return to normal operations. We are in the process of having similar discussions with our public and private hospitals.
What about the code round yesterday? Professor Sutton said that he believes hospitalisations peaked. So what considerations?
So that's also a part of the daily consideration that we put through in terms of how our entire hospital network is coping still with unprecedented pressures. Yes, it would appear that the peak has been passed, but we have just seen 1 million kids return to schools yesterday. We are seeing higher levels of movement around the community. We hope that the trends will continue on. Every indication is that that is the case, but the system-wide stresses on our hospital networks still should not be underestimated, and the value of the Code Brown Declaration that brings a system-wide response to the demands of COVID have played a real important role in helping our hospitals get through this peak. But of course, the minute we can withdraw that declaration, we will, but it's serving a very useful purpose at this time.
The Productivity Commission today said that Victorian hospitals spent less per person on public hospitals, than any other state. Have we sort of entered the pandemic from a behind position?
No, I don't believe so. That's not a particularly new revelation. The Victorian government spends a much higher amount on community and home care and other services, and has for many years in comparison to some other jurisdictions. But this is a government that is investing record amounts, be it in infrastructure, be it in workforce, or be it in services, whether they be home-based, community-based or hospital-based. And we do so because we want to have the best hospital system, not just in the country but in the world. It's under enormous stress at the moment, but every part of our system is under huge stress at the moment, but every part of our system is getting record support from the Victorian government.
The report found that Victorian hospitals have fewer beds and less available staff than below national average.
Yes, in a tertiary hospital setting, that is why we are, whether it be continuing our record investment in hospital in the home, community care, or indeed our $8 billion worth of hospital infrastructure investment, our hundreds of millions of dollars investment in more nurses, doctors, clinicians, allied health professionals and staff right across the board, rebuilding just down the road the $1.5 billion Footscray Hospital from scratch, the Frankston Hospital, the Maryborough Hospital, returning the Mildura Hospital to public hands. Right across the state, we are in the throes of the single largest investment in our public hospital system, It's not just infrastructure in hospitals, it's also the support for the unique Victorian community health services sector, which has been extraordinary during the global pandemic, particularly led by the C19 Coalition, CoHealth, Star Health, IPC out here in the West, and a whole range of others. They are a particularly Victorian iteration in our healthcare system, together with our investment in more nurses, doctors and others. When you look at the totality of health investment in Victoria, we have a world-class system, always capable of doing more, which is why this government is investing record levels in services, people and infrastructure.
Palliative care can't keep up with demand at the moment. What's being
Beg
done?
pardon?
Palliative care can't keep up with demand. What's being done about that?
So palliative care, whether it's in the private or the public system, is facing huge challenges at the moment. Palliative care as a model is under a process of adaptation and change. Yes, there is a role for hospital-based services, but increasingly Victorians look to the wider palliative care services being home-based and community-based support. The continued support that we bring to that service reflects those changes.
Why was the Chief Health Officer's advice not sought about lifting numbers of tennis, crowds, and
Oh, well, we're focused very much on making sure that issues around returning kids to school safely this week, building on our vaccination levels, that's the kind of things that we're focused on. Others can focus on matters that happened last week if that's what they want to do, but the process was pretty straightforward. The operator of the event has a COVID safe plan. It sought an amendment to that COVID safe plan. There were no public health concerns with those amendments, and the amendments were agreed to.
in regards to IVF?
In regards to,
IVF?
well, again, you've got to understand what the public health orders are, and 2 years in, I would have thought it's pretty clear that there's a distinction between hospital capacity and public health orders. As was made clear in the inquiry, the public health orders are the domain of advice from the Chief Health Officer and the Public Health Unit. Hospital capacity issues are an issue, as we've touched on with the Code Brown and other declarations, issues for the State Controller of Health around hospital capacity. There's different people doing different roles in an integrated system.
Will you be seeking his advice on vaccine boosters? Touched on this before, but will that be part of your...
Of course. We've had multiple discussions with the public health team every step of the way around the importance of the third dose program, of the importance of the vaccination program with children. I've had that discussion on multiple occasions with the Chief Health Officer, his deputies and the entire public health team. I don't understand what the process is. People who choose to be blindly and deliberately ignorant of this do the Victorian people no justice. The system is, what constitutes being fully vaccinated is a matter for the Australian Technical Advisory Group. They are going through that process right now in a thorough and professional way. We urge them to do that quickly, which is what the Victorian and indeed other governments have done. But once they do that and report that to National Cabinet, then the process is we look to how we consult and engage right across the community about the best way to achieve that goal of the highest possible levels of vaccination. And we do that because we know vaccines work. Some people want to chase anti-vaxxers down every obscurantist rabbit hole to obtain we don't know what advantage and bring into question the vaccination program. That's not what the Victorian government's here to do. We are here to go through the processes in partnership with the Commonwealth and other jurisdictions to drive up vaccination rates, to take the pressure off our hospitals and to keep Victoria open and keep our families and communities safe.
Just to be clear, though, you spoke to Greg Sutton about mandating for those 6-year-old
No, I didn't say that at all. I didn't say that at all. What I said is we go through a process of how we get vaccines maximised in this state and in this country. The process is pretty clear. The Australian Technical Advisory Group define what constitutes being fully vaccinated. They are very close to resolving that. I would expect that to be 3 doses when it comes to dealing with Omicron for the majority of the community, and indeed 4 doses when it comes to immunocompromised and vulnerable people in the community. That applies nationally because the vaccines are supplied nationally. When that is done, all the states, including Victoria, then will look to an arrangement about how we maximise those vaccination levels. And when that part of the process occurs, we will engage in the next step with the public health team about how that arises. To be clear, every week we talk to the public health team about what's the best way in which we can drive forward our vaccination outcomes. Arrangements like today, the K-pop program, that's about making sure that those vulnerable kids and their families who are underrepresented in vaccine outcomes have a fair chance and support to get their vaccination levels up. So there's no mystery or surprise to this. This is just yet another opportunity for those people who have contradictory positions seemingly every week on issues vaccine and pandemic response, who are deliberately and willfully beating up issues around the vaccine program. And the vaccine program is our ticket out. As Lindley just pointed out, science works, vaccines work. If members of the Liberal Party want to doubt that fundamental scientific truth, that's up to them.
As part of the code brown, council and maternal and child healthcare workers are being diverted away from their usual screening checks to help out in other parts of the
Yes.
sector. Are you worried that important health issues and babies are coming through this?
So we thank the local government partners right across the state who have stepped up big time over the course of this Omicron variant wave to help out in the system. That has not come at the expense of the programs to keep kids and families and particularly newborns safe, but it has put extra pressure on that system, and we're working with local government, with the maternal child health and welfare sector to address that, and in the context of when we come off this wave, that will be one of the priority areas of making sure that those areas of deferred care are reprioritised as quickly as possible.
Could surge payments for healthcare workers be extended beyond February?
Yes, they will be. I want to thank the frontline healthcare workers who are eligible for that surge allowance. They have been working, all our healthcare workers have been working extraordinarily hard and in difficult circumstances every day for over 2 years now of this global pandemic. Their exhaustion, their fatigue is well known, and that is why the Code Brown is in place. That is why the arrangements around deferral of non-urgent Category 1 elective surgery in place. And that is why this surge allowance is in place. Hundreds of millions of dollars of investment in our frontline workers in that sector because they deserve it.
There's been a lot of talk about
Ask questions.
the city in the wake of its tennis. When might the working from home orders be lifted and what factors trigger that lift?
Well, just let me pick you up on that. There are no working from home orders in place. There are no pandemic orders restricting workplace arrangements. What there is a recommendation, and Victorian employers and employees have worked through this issue, and in regards to the recommendation to work from home if you can, that remains in place, but of course we review that actively all the time. When it's appropriate to do so, we'll have more to say about that. But what we're seeing as increasingly numbers come off, we're seeing mobility numbers go up, and we're seeing services, whether it be schools, whether it be early childhood and learning centres, whether it be workplaces, make a sensible judgment about what's safe and appropriate. But to be clear, there are no pandemic orders in place restricting working from home arrangements.
But do you have a sort of a timeline on when that recommendation might be on the horizon? I think
Well, when we get the discussion from the Chief Health Officer and his public health team as to what's the appropriate time for that, then that's when it'll happen. But those conversations happen literally every day, and when that advice comes forward, I'm sure we'll have more to say about it.
just got one question for you on Westgate tunnel compensation. Talking very soon today. Why did the government change legislation relating to land acquisition so that people in tunnels under their property won't be compensated?
Well, no such arrangement has been put in place. What we have in place is what is applied for many, many years of a system that allows compensation below a certain level of depth of tunnels to be dealt with through an expedited process. What this legislative arrangement that was thoroughly well shared in the public debate at the time is to make sure that the compensation goes to the people who need it as opposed to a potential lawyer's picnic. What this is about is looking after the very people who the compensation needs to be targeted to. Anything else? Yes? Yes. All deaths associated with this global pandemic are tragic arrangements, and can I again use this as an opportunity to send our condolences to those families, loved ones and communities of those who have lost their life over the pandemic. Sadly, with the Omicron variant and now the next subvariant, we are seeing increasing levels of infectivity. Fortunately, it's not as virulent as strain, but what we're seeing as more vulnerable people come in reach of the highly contagious variant of Omicron and its subvariants, that we continue to see high levels of illness, hospitalisation and sadly deaths. This is a global pandemic that is taking millions of lives around the world. That is why it is so important that we come forward and get vaccinated, that we have the measures such as the K-pop program to encourage those kids in vulnerable communities and families to get vaccinated, that we take every sensible measure to drive up vaccination rates. That's our focus. Our focus this week is schools and driving up those third dose vaccines. That's what we're working around the clock on, and we're motivated by that to make sure that those tragic death numbers and hospitalisation numbers come down, and that is what our public health team are all united with Victorians in delivering on. Anything else? Nothing else for Jerome or anyone else? All right, I expect to see you all in there racing Kathy Freeman. Thanks.
If anyone wants to go in to get some music for the science work,